So this is a chart to show what we've come through over the last several months. You can see the cases by month on the left and the deaths by month. So you can see those metrics there. You can see where we had a high of 78 deaths the month of January due to, I think a lot of us, because we had such a high caseload, 25,047 cases. So you can see those numbers and look at the comparisons. I do believe we're coming out of this, as you'll see in this next slide. Our cases are down 67%. Deaths are up 10%. They haven't. They've started to level off. They're not rising at the pace they were. So that is a good thing, and that's what we see in other jurisdictions where Omicron hit sooner. Is cases go up, then hospitalizations go up, and then deaths go up. But usually also what happens is it goes up, plateaus, and then goes down. So you can see the hospitalizations, they're going down. Atrium had 181 in their system for this area, 236 last week. Novant saw a similar decrease from 192 last week to 159. So both going in the right direction, same as our cases going down. Just said, we're looking at that. There has been some discussion, myself and Dr. O. Haven't talked with the mayor yet. We're not at those marks, those metrics that the mayor set last fall. But, those states that are seeing those mask mandates be lifted or set those dates, again, they're 3 weeks ahead of us as far as they had their Omicron surge earlier than us. So we still have a little bit of time left before I think we're going to be in that situation. Hopefully it could be sooner rather than later. But as we keep this downward trend of cases and as the deaths start to level off and decrease, we hope, I think we'll be getting closer with each passing week. I don't think we're ready yet here. If you look at the CDC, 99% of counties in the whole nation are still at high transmission rates. Really, even some of those counties in the Northeast are at high transmission rates. But as we see the numbers start to fall and the cases start to fall, I think we'll get closer and closer to those metrics and be able to lift mask mandates. Yeah, I think you're seeing that. Obviously, a big thing is we're waiting on CDC guidance. CDC has been rather, this has been rather interesting because it was just a few weeks ago we were talking about upgrading your mask, surgical mask to N95s. And now you're starting to see this trend of across the nation, the states, like I said, in the Northeast, especially looking and setting dates to lift their mask mandates. So I have, read, I know that the federal government with the CDC, they're looking very, they're talking and doing a lot of discussions behind the scenes about, what's next with the mask and how to, like you said, move on past this pandemic. For us, we're still waiting on, we follow DHHS guidance at the state and then CDC guidance from the federal level.